See that?
Yes.
Yes.
Great. Okay. Well, thank you very much for this opportunity. Thanks for the introduction, Fred and Lynn. It's a pleasure to be here. And yeah, oral health is more than a nice smile. So let's find out why oral health is more than a nice smile. And I'm trying to change my slide. There we go. Okay. So I'm a member of the District of Columbia Dental Society Foundation, and the Dental Society Foundation is a charitable and educational arm of the Dental Society. The reason I got interested in this topic was because in my practice, I was in practice for about 35 years or so. And, when I started out, I had people who started out in their 40s or 50s or 60s. And over the course of my practice, as they got older, of course, I didn't get older, but somehow they seemed to get older. I noticed that something was happening to some of them. That is that some of them would lose their ability to self-care. And previously, when they had been healthy and their mouths were healthy, things were going downhill. And when they were accompanied by their healthcare aide or maybe their children, and I looked in their mouths and I saw, infections and loose teeth and things like that. I was wondering why that was going on. It was because they were no longer able to self-care, and the people who were taking care of them were not educated in how to do that. So that's one of the things that we've been doing, is going out and talking to home care aides and certified nurse assistants and providing a program for them to learn that. And in terms of you all watching this now, I suspect that most of you are very capable of self-care, but some of you may have parents who are in nursing homes or long-term care facilities. And some of us, as we get older, may lose our ability to self-care. You might be married to somebody or have a partner who is losing their ability to self-care. So I hopefully what you will be learning in this little lecture will help you to understand what you should be looking out for and the importance of doing what you should be doing. So here's kind of a general outline. So we're talking about, so we can understand how does the mouth work, its relationship to the rest of the body, its implications with oral health, and how, when things go south, how poor oral health can get us in trouble. We'll go over some oral health basics, how to take care of your mouth, and then we'll talk about some of the things that are in our mouths, fillings and prosthetics. And then I think importantly, what you should know about your dental examination, what you should expect as a consumer of dental care. And we'll finish up by talking about some additional healthcare aids, and I'll open up for questions and answer. So an important concept here is for oral health is homeostasis. So homeostasis are the ways our body has and to keep us healthy. There are kind of auto-regulating systems in us, and we're very well designed entities, human beings. And we are trying. Nature is trying to keep us healthy, and if we give nature a little bit of help, we can do that. Unfortunately, if we don't take care of ourselves, then some of these homeostatic mechanisms get thrown akimbo, and we start becoming unhealthy. So the first part of this lecture will be about periodontal disease and gum disease and things like that. And in order to understand that well, we need to understand microbes and germs and bugs and stuff like that. So, as you know, we are surrounded by microbes. They're all over us. They're the most numerous entity on Earth, living entity on Earth. And if they get inside us in a bad way, that's what can kill us and make us sick, as we found out with COVID and everything else. But luckily, our body has wonderful mechanisms to try to keep things where they belong. For instance, we have skin, and skin is a wonderful barrier to keep microbes from getting inside us that shouldn't be there. And of course, we have microbes that should be there. For instance, in our lower intestine, in our gut, we need these bacteria to help us get the nutrients out of our food. And there are a few other places where microbes should be. But for the most part, when we are born essentially sterile of microbes. And as soon as we go through the birth canal, we pick up important microbes from our mothers. And in terms of our mouths, when your mom puts her finger in your mouth and say, how you doing? She's citing, and rightfully so, seeding us with the kinds of bacteria that we should have, because we need these bacteria. And a concept I want to make you understand is that we are supposed to have plaque in our mouth, the bacteria, but there's a certain type of bacteria that should be there, because when you have the good bacteria there, it keeps the bad bacteria out because it takes up the space. So, our mouth and our nose are kind of unique areas because we need to have them open to the outside world, because that's how we breathe, and that's how we get nutrition. And our mouths are one of the first places where we have microbes have access to our bodies. So, but of course, sometimes the barriers can be breached. As you know, if you cut your finger, certain things happen. It gets red, and it gets swollen. This is actually what's going on, is that your immune system is getting to work, because there's a wonderful array of cells in your body that go in to try to eat and destroy the bacteria. And then if the infection is bad enough, we have this thing called innate immunity, which are things like the skin and these small cells that can kill and eat bacteria. Then we have, actually only vertebrates have this adaptive immunity where we can create antibodies. So there's a wonderful array of systems to help us keep healthy. And as I mentioned, we have lots of bugs in our mouth. So there are actually over 700 species of microorganisms in our mouth. And the interesting thing is that they live in certain ecological niches. And as happens in most evolution, but maybe on a much quicker scale, they're always competing with each other for nutrition and for space. So you can kind of think of your mouth as a little microcosm of what's going on in the rest of the world at a more rapid pace. And if you have a healthy mouth, it's called eubiosis. That is, you have the right kind of biosis, the right kind of living things living in your mouth to keep your homeostatic mechanisms in good array. But if you don't have that, you have what's called dysbiosis. And dysbiosis is when unhealthy and pathogenic bacteria can get a foothold and actually start changing the actual environment of your mouth. So let's take a look at what's going on here. So as you can see, this is a tooth, and this is kind of a cross-section of a tooth. And what you see going on is that on the left-hand side, where it says health, you see the skin has a very tight connection to the gum. And what's going on, there's an actual physical connection. There are cells that go into the side of the tooth, and it's a skin barrier. It protects the bacteria from getting under the gum line. So when someone who's taking care of their mouth, they have the ability to take care of their mouth, the kinds of bacteria that are living there are more or less, commensal. They're healthy bacteria, and it's not causing a problem. But let's say someone is no longer able to take care of your mouth. Your mother, your father's in a nursing home, and the aides don't know how to brush their teeth, don't know what to look for, don't know what to see. As you can see, heading towards the right, and I kind of drew it going from yellow to orange to red. What happens is the bacterial population changes. It changes from this healthy kind of bacteria to an unhealthy bacteria and disease-causing bacteria. And you can see plaque and tartar growing along the side of the tooth. But then what I want to bring your attention to particularly is that little blow-up area. What's happening there is now, instead of the gum being tightly attached to the tooth, you now have an opening in the space, because these pathogenic bacteria are going in and actually destroying the cells and using the dead cells as nutrition and growing. And now bacteria are actually getting into your body where they don't belong. This causes local inflammation, bleeding gums. Some of you may see that in your own mouth. Hopefully not, but you might. By the way, you should not have any kind of bleeding gum if you brush or floss your teeth. It shouldn't be bleeding. And if you do, there's a problem. But the other thing you can see happening on that side of the tooth is bone loss, because the toxins produced by these bacteria and the inflammation induces bone resorbing activity. And that's why people start getting loose teeth when they have periodontal or gum disease. So what happens now is that now there's pathways for oral infections to create secondary systemic effects. So instead of just having a problem in your mouth, you have a problem in your body. So how does this happen? Well, it happens through various mechanisms. One is something called bacteremia. So the microbes translocate, they go out from where there should be and into where they should not be. There's actual traveling of bacteria through your bloodstream or through the tissues. And besides the site and the gum where I showed you where it causes injuries, it could also can cause toxins, can cause injuries to remote parts of your body. We'll talk about that. And also there's inflammatory products, cytokines they're called, and they're kind of little messaging systems to your body to tell you that there could be something going on, something wrong. So there's a communication between these cells and the rest of your body. So what can happen? So you can see this is kind of a diagram of the bacteria and toxins entering into your bloodstream. So where can they go? What can they do? So there are little arrows to some various organ systems. So in diabetes, diabetes is incredibly common in this country and getting commoner. And there is actually a kind of a relationship between diabetes and periodontal or gum disease, because when you have gum disease, the inflammatory products will actually exacerbate your diabetes and make it get worse. And when you have diabetes, as you may know, your circulatory system has problems, and it can make your gum disease get worse. So there's kind of a mutually disadmiration society going on there. Cardiovascular disease, yeah. It's been noted that the inflammatory products and actually the bacteria themselves can get into arteries and cause roughening of them, which promotes plaque formation there. Can occur in your carotid arteries also. There's implications in Alzheimer's disease with certain types of bacteria. Porphyromonas gingivalis is one type. A pathogenic bacteria can get up in there, and it's been implicated in Alzheimer's disease, rheumatic diseases, arthritis. The inflammatory products can cause your body to have an autoimmune reaction and start causing problems within your joints. And respiratory diseases. One of the big problems in nursing homes and long-term care facilities is something called aspiration pneumonia. So, of course, every time you breathe, you are getting some bacteria from your mouth into your lungs and your respiratory system, but we have these wonderful things called cilia, which kind of push out the bacteria and there's a self-cleansing mechanism. But in people who have trouble swallowing, many times older folks have trouble swallowing, they can aspirate or get clumps of food or food that has impregnated with bacteria into their lungs. And if there are pathogenic bacteria and they're unhealthy bacteria, it can promote aspiration pneumonia, which is a big killer of folks in nursing homes, as you may know. So let's take a look at this. So those are some of the things that can happen. So let's take a look at mouth. So when I asked my wife, Andrea, what's the difference between the one on the left and one on the right? She said, well, the one on the right has wider teeth. That's true. But what I would like to bring your attention to is the one on the right. If you look at the gums, see those little kind of red halos around there? So those are all areas of gingivitis or gingival inflammation. So you don't have to be walking around with a huge problem to be having these low-grade infections in your mouth as this person has. Now, different areas of your mouth have different situations that need to be cleaned differently. For instance, your front teeth are more or less self-cleansing because your lips and your tongue are there. And it's kind of rare that we see cavities in the front teeth or the lower front teeth. It happens, but it's a little more rare. But when you go to your back teeth, for instance, in this case, it's harder to keep this clean because you have a tongue there in the way when you try to brush it. And actually, these back teeth have implants in them, and you have to use special tools. So there's a different ecological environment here, and it requires, and we'll go over this, different tools to keep this clean. And similarly, on the upper back teeth, it's hard to reach back there. You have to use, this is a person has a bridge. You can't just use toothbrush there to try to keep it clean. You need something else to keep it clean. Some of you may have done this, or maybe your kids have done this when they go to the dentist, they chew this little red tablet. What I'm showing you here is that plaque. So this biofilm or plaque lives everywhere in your mouth. And as I mentioned, normally it belongs there. But I think you can see it maybe gathers in certain places, for instance, in between your teeth. You know, about 40% of the gum tooth interface occurs between your teeth. So if you're not flossing in between your teeth, you're essentially missing 40% of this very important area. And if you remember back to that little shot I showed you of what's happening, what inflammation occurs by the gum, those are the areas where you may not have bleeding when you brush your teeth, but if you floss your teeth and you get bleeding, that means there's some kind of problem going on there. So how do you brush your teeth? This may seem kind of basic, but I can tell you from my years in practice is that the main problem people have in brushing their teeth is they don't spend enough time doing it, and they're not methodical about doing it. So if I can make an analogy, if I were to shave my face in the morning the way many people brush their teeth, I'd have tufts of hair growing out of my face because I'd kind of do it randomly. I know because I can feel where I'm shaving that I have to go in a pattern, and I have to, in order to get, myself shaved, that's the way I have to do it. Well, similarly with your teeth, you can't see the bacteria and the plaque on your teeth, but you have to go everywhere in order to remove it. By the way, what you're doing is you're not totally removing plaque from it. All you're doing is keeping the number of bacteria below a certain threshold that your body will react to. So for instance, if you don't brush your teeth for a day or two, you may not have a problem. But if you go for a week or something like that, what happens is these pathogens, you now create a local situation where there's a reaction between you, the host, and the bacteria. You've changed the ecology of your mouth. And what's happened is now you start developing pathogenic bacteria. So in order to keep it healthy, you have to do it in a pattern. And what I recommend is, you can go side to side, use a soft brush, do not use a hard brush, and go back and forth all across the top. And don't forget to do the inside of the upper teeth. And similarly on the bottom, do the same thing. So people ask me, how long should it take me to brush my teeth? And I say, well, if you do it according to this pattern, it's going to take you at least a minute, and maybe like 2 minutes is good. Again, it's like if you take a shower, you don't want to just clean the right side of your body. You want to clean your whole body. When you clean your mouth, you have to clean your whole mouth. Now, the problem with brushing your teeth is that it's, the good news is that it doesn't involve pharmaceuticals, and it doesn't involve high-tech machinery. But the bad news is that it involves you having to do something. So it's kind of like, losing weight or exercise. It's that little brush is the key to keeping you healthy, but you have to use it. You have to use it the right way. So yeah, and don't forget to floss in between your teeth. You can use your hands, or you can use these little flossing devices. There are also other things I'll talk to you about. Okay, so now we'll talk about cavities. And, when I was growing up in Brooklyn, we lived more or less on top of a candy store down below. So I always had something dissolving in my mouth at any moment. And, I don't know if you've read that book, Guns, Germs, and Steel by Jared Diamond, but he says one of the worst things that happened to mankind is we went from hunter-gatherers to agricultural. Well, our diets have changed, and they've really changed, in more recent years in terms of carbohydrates and refined sugars and things like that. So there are certain parts of our tooth that are more susceptible to decay than others. For instance, in between your teeth, you can see that towards the left. That's why flossing is important, because where your teeth touch, just that little area there can collect bacteria, and the bacterial acids, and the bacteria produce acids, and the acids will now eat away at your tooth on the biting surfaces of your teeth. And also, one thing that happens when we get older is that there is normally occurring a little bit of gum recession. So now the roots of our teeth are exposed, and the roots of our teeth don't have enamel covering. They have something called cementum, and cementum is much less mineralized than enamel, and you're much more susceptible to getting a cavity there. And root surface cavities can get, deep quicker. And one thing you might notice that in the middle of this tooth is the pulp, which is the nerve of the tooth. And if decay hits the nerve of the tooth, you probably need to go and have endodontics or a root canal or the tooth extracted if it's bad enough. The other thing you should know is if these bacteria get into the pulp of your tooth, it now has another pathway of getting out of your tooth and into your bloodstream. So an infected tooth is it's a real health problem. So how does decay happen? So draw your attention to the tooth on the left. So you see the term eubiotic, that's a normal or healthy biofilm. As I mentioned, that stuff belongs on there. But let's say you live on top of a candy store in Brooklyn and you start eating a lot of sugar. What happens is that you will actually induce a different kind of bacteria to grow in your mouth. So there's certain bacteria that promote that eat carbohydrates and promote tooth decay more than others. So you will now shift the local environment, because now, again, it's kind of like the law of the jungle and survival of the fittest. Now these bacteria, which prefer these carbohydrates, say, wow, there's all these carbohydrates. Let's go to town. So they reproduce more. So now you have Streptococcus nutans is the name of it. But you have this type of bacteria that they grow, and now you have what's called dysbiotic oral film. And then you get cavities. So, there's a difference between your tooth surface and your gum surface, in that, your gum and your mucosal surfaces and the lining of your respiratory tract and your digestive tract, it sheds, it grows new cells on the surface, so that's a way of more or less healing itself and renewing itself. But your tooth, which has bacteria living on, cannot shed surface. Once it's formed, it's formed. So, that's why you need to remove the bacteria regularly, because your body can't do that normally. So I'm a big fan of spit. So, saliva is really, really important, because saliva has minerals in it that remineralize your teeth, and also has antibodies in it. So there is a constant exchange in your mouth. Part of this homeostasis I mentioned, there's a constant exchange in your mouth between your saliva and the surface of your enamel. It's you have minerals going in and you have minerals going out, and that's the way your body naturally replenishes itself. And what happens if you get a dry mouth, and I'll talk to you about later how that's pretty common, you now disrupt this cycle, and you now get demineralization and cavities forming. Typically, they'll occur, if you look on that left side up by the gum line, because remember that picture I showed you before of where the plaque occurred, all the red, when you chew that red stuff, that's because that's where your lips aren't normally cleaning it, and you'll get, it was really disheartening in my practice. I'd have my older patients come in who couldn't self-care, and they'd have a lot of these, and they're really hard to treat, So that's why, keeping your mouth healthy is very important. Also, if you have parents or loved ones who have not the ability to take care of their mouth, really, try to encourage them or their caretakers to do so. So here's the ubiquitous Venn diagram. So, this can actually go for many disease processes, but in terms of your mouth, so what causes cavities? So you have a susceptible tooth. So a susceptible tooth might be a tooth that has a lot of pits and crevices in it, or it might be someone doesn't produce enough saliva in their mouth. And then you have plaque, which occurs in your mouth naturally. But let's say you now have, because you live on top of a candy store, you now have a lot of, you shift the bacteria to the kind of bacteria that produces cavities, and then you have the sugars. And so when you put the milk duds in your mouth, all three come together, and when they come together, that's when you get cavities. So in order to shift this, there are things we can do. For instance, make your tooth less susceptible by maybe taking better care of it and reducing the amount of sugars that you're eating. Our saliva has a pH. A pH is a measure of the acidity generally, and our saliva has a pH of about 7 or so. And this is just to diagram what can happen. So, things like, say lemon juice or coffee or wine, all the good things in life are acidic. And so as soon as they get in your mouth, they start to, start eating away, because that little chemical reaction I was showing you before starts shifting towards the acid side. And your saliva is trying to move it towards the neutral side. There are a few foods such as milk, and we see egg whites here. I wouldn't recommend putting Drano on your mouth, but there are certain things that are more basic that can help out. But what I'm trying to show you here is if you can move things towards the neutral side, then that's good. So how do you do that? So let's say you eat some candy, right? Or you drink a soda or something like that. What you should do is, if you can brush your teeth, that's great. If you can't, just take some water and, switch them out and swallow. So what you're doing is you're getting it off your teeth, and you're helping to help your saliva get it more towards a neutral. I had a patient who had really good oral hygiene, but he was always getting cavities. I'm trying to figure out what is it about his mouth that's doing it. And I was asking him about how he spent his day. And he was a computer kind of guy. He spent a lot of time on his computer, and he had a can of Coke there. And what we discovered he would do is he would work on a computer and drink some Coca-Cola, work on a computer and drink some Coca-Cola. So what's happening, he was constantly bathing, and he'd go through maybe 2 or 3 Cokes a day. So he's constantly bathing his teeth in acidic sugar, So and his saliva wasn't able to neutralize that. So, and this is something you may want to think about when you're, again, you don't have to carry a toothbrush all the time, but what you should do is think about how you live your life in terms of your teeth, particularly if you're cavity prone. By the way, some people are just cavity prone because of genetics, so don't beat yourself up too much. But what you try to do is move yourself towards this homeostasis and self-care. Fluoride. So how does fluoride work? Well, we get fluoride in our drinking water and fluoride in our toothpaste, and overfluoridation is not good for your teeth or your body. But what it can do is that fluoride is a more active element, and when it's in your toothpaste, it preferentially binds, through that little chemical reaction I was showing you, where things reattach to your enamel. It chemically binds to your enamel, and since it's more chemically active, it produces a stronger bond to the enamel. So so normal tooth enamel is called hydroxyapatite, and some portion of your tooth enamel becomes fluorapatite. And fluorapatite, it's harder for the acids to dislodge the minerals because it creates a stronger bond. That's how fluoride can work. So that's kind of some basics about the biology of your mouth and what you should be doing. So let's talk about what happens to us as we get older. So a couple of things happen. There's things that happen to our bodies that we're very well aware of. There are medical conditions. There's socioeconomic and things that happen to our cognition. So something very important I want to talk to you about is xerostomia, or dry mouth. So this is really quite a big problem. As I told you before, saliva is super important for keeping your mouth healthy. And there are many, many drugs that cause, polypharmaceutical, I forgot what they call it. People are taking many, many drugs. And many of these drugs have the effect of causing a dry mouth. And some of you might be experiencing that. You might notice your mouth just feels dry. You might have some difficulty swallowing pills, things like that. Well, besides the discomfort of that, as we've talked about, you now have a dry mouth and the saliva isn't there to replenish the enamel, and you get these cavities up by the gum line. If you have a dry mouth, you should be, there are things you can do. You should be, sipping water. There are some, if you go to the drugstore, they sell these, they're called saliva substitutes. There are things that you can, they usually have some glycerin in them that keeps it kind of a little more slippery, more comfortable. And also it's important, again, to keep your mouth as clean as possible. So again, if you have a dry mouth, taking many medications, try to keep, if you eat something or drink something acidic, like a Coca-Cola or even coffee or wine, try to, as soon as you can, kind of rinse your mouth out. Just swallow it, swallow some water, rinse it out, and that'll help keep that okay. Then economic things. Yeah, so many of you, when you had your jobs, had insurance, health insurance, and dental insurance. So you retire, and all of a sudden your insurance goes away. So what are you going to do? Well, as Fred was mentioning, well, of course we have, depending upon when you retire, there's Medicare or Medicaid, and that can pick up your medical insurance. But unfortunately, there is no real dental insurance under those plans. So you might be able to buy a plan, but it's quite expensive, and usually it's kind of limited. So what I'm trying to say is, if you're retired, one thing that can happen is people lose, they're in a pattern of going to the dentist, say every 6 months or a year. They lose their insurance, and they're disincentivized to go to the dentist because of finances. But it's quite important to continue your dental visits, because besides checking for cavities and things like that, oral cancer is more common as we get older. It's important to have oral cancer screening. So what you should do is to maintain your dental appointments, even if you don't have dental insurance. The other thing that happens to us, so we can have physical and mental decline. So this could certainly happen to us. You may be living with a spouse or partner who has some problems. So what you need to do, if that's the situation, is you need to monitor them. So if they're going to the bathroom and brushing their teeth, see how we talked about how they should be brushing their teeth. So make sure they're doing that. Or maybe you can do it. You can do it for them. You have to be their healthcare provider. So I'm sure if you're in that position, you're watching out for, you're making sure they're taking their medications and doing other things to keep them healthy. Well, just remember that we talked about all the bad things that could happen if you have oral diseases. You have to do that. And besides that, if you have a loved one in a nursing or long-term care facility, make sure they're getting their mouths taken care of. Ask their aide, what are you doing? Ask your loved one what's happening to you. And then as I mentioned, our Dental Society Foundation is providing a program of training for these folks. So hopefully what's going to happen gradually is that, as Fred said, this will become a more of awareness of this as an important aspect of our health. So now let's talk a little bit about fillings. So I know I'm going a little faster. I'm trying to give you 30,000 foot view of your mouth, but let's talk briefly about fillings. So there are all sorts of different kinds of fillings. There's gold fillings, silver fillings, white fillings. A frequent question that was asked of me was, Sal, do I need to have my silver fillings taken out because of, they're worried about mercury or things like that, or they're old, should I get them taken out? Well, my answer is no, you shouldn't get them taken out because of the fact that amalgam contains mercury. It's not bioavailable mercury. And also, there's no particular age when fillings should be taken out. However, what does happen is that because the mouth is a dynamic place, you're chewing, a lot of forces on it, it's hot, it's cold, you're drinking coffee, Lynn. And then what happens is that they expand and they contract, and you'll get openings in them. So yes, they do need to be replaced. And now these days, not too many dentists are replacing silver fillings with silver fillings anymore, amalgams. They're using composite resins. And when done properly, composite resins can be quite good. They also look better. They're a little more technique sensitive. I think they cost a bit more than amalgam fillings. But these are the kind of things you should always ask your dentist, why are you placing that? Why are you using that material in my mouth? And they should be telling you why. Of course, there are crowns that you can see on the right, and that's where the whole tooth, maybe you have such a big filling that the tooth breaks or it needs to be replaced. The filling and it's too big, so that's when you would need a crown. There are implants. Some of you may have implants. Implants are neat. So instead of having to have a bridge placed, an implant is a titanium. It's made of titanium. It's placed in the bone, and then a crown is eventually placed on top of that. What's nice about that is you don't have to drill on the teeth on either side to have it done. Implants can last a very long time. They need a little bit special care to take care of them, and it doesn't make you have a tooth impervious to maybe you won't get tooth decay, but you can certainly get periodontal disease. And I've seen many implants being lost to periodontal disease because it can take a little special cleaning. And also your dentist should be aware that it might need some special cleaning to take care of that, because you can get something called peri-implantitis, which is an infection along the edge of the implant between the titanium and the bone, and then you can lose bone and you can lose an implant. So yes, implants are great, but they don't make you impervious to periodontal disease. Then dentures, fewer and fewer people are wearing dentures these days because we are keeping our teeth longer, but there are removable dentures and partial dentures. If you have a denture, they should be removed every day, usually at night. You should be cleaning your denture with a denture brush, is a special kind of not a toothbrush. And you should be keeping them in waters just fine. You don't have to keep it in anything special. Do not keep them in bleach, which will degrade the plastic. Do not keep it in mouthwash, which will degrade the plastic. Water is fine. If you want to put it in this polydent, that's fine also. And then there could be very extensive. Here's examples of a mouthful of crowns that are supported by implants. You may have seen advertisements for this in places. So there are ways of replacing your entire dentition with implants. Let's talk about your dental appointment and your dental team. It's very important to maintain your dental visits, as I said, and that you remember that your dentist works for you, and you should, if you have questions, you should ask questions. You should never feel intimidated to ask questions of your dentist, and they should be answered satisfactorily to your satisfaction. So what should an oral examination consist of? First of all, needed x-rays, and we'll talk about that a little bit later, but how often should x-rays be taken? And the answer to that is it depends. For instance, if you are a young person, you never get cavities, maybe only every several years you need to take it. If you're someone who continually gets cavities or monitoring a particular condition, you may have to take it every year, every 6 months, occasionally even more frequently that, although not usually. So, but you should ask your dentist. I would say instead of being on a fixed schedule, like everybody gets x-rays every 6 months or everybody gets this, you should ask your dentist, why do I need x-rays at this regimen, and that should be answered to your satisfaction, because everybody's mouth is different. You should tell them of any changes in your medical history. They should ask you of any changes because that can have implication on what procedures they do on you and what they see. An oral cancer exam must be given every time. And part of the oral cancer examination is they should grab your tongue with a piece of gauze and pull it out of your mouth and look on either side of your tongue, because the most common side of oral cancer is the side of your tongue. And if it's usually squamous cell carcinoma, and if you catch it relatively early, it has a decent prognosis. If it's catch later, it has a very poor prognosis. So they should also check your neck and this whole area over here as part of your oral cancer examination. They should do a periodontal exam and charting. What that means is they check your gums. They have a little probe that probes annoyingly underneath all your gum line in many spots. And what's being done there, and that probe has little marks on it, and they're measuring how far under your gum line it's going. And you can tell by how it shouldn't go too far. If it goes too far, that means you've lost bone or there's a problem there. So that's what that should be done at every visit. It could be done by a hygienist. At some point, a baseline record of your periodontal charting should be done so that when the dentist is checking, no, it was a 3 here, and now it's a 5. Something's going on there. So that's something, that should be done. TMJ is your temporomandibular joint. Many people have clicking or problems or jaw joint problems. So that should be palpated and checked to see how that's working. Some of you might be wearing night guards or things like that. If you do wear those things, always bring them in so they can be cleaned and checked and making sure they're doing a good job. Then, of course, your teeth should be checked for cavities, regular dental exam. You should ask if you have any problems or concerns. So one thing you might want to do is you're noticing something one day, this tooth feels funny when you bite on it. Well, maybe make a little notation to yourself or something like that. Some people have a medical log, which I think is a good thing to have in general for your health, because you may notice it, on the month before, and don't notice it again. And then you go to the dentist, and you forget to mention that. So maybe you have make a little notation yourself, because there might have been a crack in a tooth developing or something like that, that when you bring that to the dentist's attention, they'll see it. They should ask you if you have any problems or concern also. Sometimes photographs are taken to record things. We used to have an intraoral camera where you can take pictures of inside the mouth. And sometimes models are taken of the mouth to follow certain conditions. So, it's pretty extensive what should be done. So let's talk about x-rays. As I mentioned, your x-ray dosage should be calibrated to what your needs are. And so many people ask me, how dangerous are dental x-rays? Well, first of all, of course, no x-rays are better than x-rays. Unfortunately, we need x-rays. So we have to expose ourselves to some radiation in order to check certain things, because dentists don't have x-ray vision. So there are various ways of measuring how much radiation we get in our bodies. One way is called millisieverts, it's one way of measuring absorbed radiation. So this is just an example of what we get. I highlighted certain things. For instance, if you lived in Denver per year, you get 0.8 millisieverts. A full mouth series of x-rays, depending upon the film, you'll get like 0.17 or 0.09. And then you can see what you can get from a mammogram, which is 0.8, excuse me, 0.42. So, these numbers are, I don't expect you to remember these numbers, but just you should know is that basically it's low radiation you're getting from dentistry, and you shouldn't be too concerned about getting it. However, you should be covered by a lead apron with a little thyroid protector on there. And again, you should only get the x-rays, that you need according to a schedule that suits you. Okay, so what should your dental hygiene routine be? First of all, daily routine brushing after meals. If you could do it after every meal, great. If not, when you can. You should be flossing daily. You should be cleaning your tongue, and I'll go over some devices that can do that. Why should you clean your tongue? Because a lot of bacteria live on your tongue, and although your tongue is fairly self-cleansing, it's good to kind of reduce the bacterial load on there. But you may have a personalized program. You might have some targeted cleaning aids for around implants or around crowns and bridges. You might be particularly prone to getting cavities. So that's where fluoride rinses can come in handy. Also, some of you may have actual fluoride trays, which are a fluoride gel is put in your mouth and for a certain amount of time. This is helpful for people. I've had patients who have had head and neck cancer, and they've had their salivary glands wiped out, and they really need some extra help in keeping them from getting cavities. Also, you might have some medicated rinses. So here's some examples of we were talking about flossing. Here's some special things, these little brushes. So what happens is as we get older, we can get some spaces. You may notice that when you eat stuff, you're getting stuff stuck between your teeth, or you didn't used to get stuff stuck between your teeth. Well, there is normally occurring some recession that occurs on a yearly basis on a small level. If you have gum disease, it happens quickly. But there are these spaces developing, and sometimes flossing is not quite as effective as cleaning because it can't really get up against the side of the tooth. And that's where interproximal brushes can be really handy. And they come in varied shapes and sizes. So if you have a large space that collects a lot of food, that's a space where you should be using an interdental cleanser. And talk to your dentist or hygienist about what type would suit you and what they recommend. They can be quite handy. There are toothpicks you can use. Some people don't like flossing, won't floss, can't floss. And then I recommended these things called stimulants. It's a little toothpicky kind of thing. It can help. It's better than not flossing, certainly. Some people like interdental stimulators for getting in between there. Now, one thing you should know, you can overdo it. You can over clean your teeth. So, you don't want to get in there. And I saw people who actually, with the toothpick particularly, overdid it, and it actually caused some gum recession. So, follow the advice of your dentist on that if you're using these devices. Tongue cleaning devices, there are a couple you can have. They come in these little metal things. You can scrape your tongue scrapers. There's brushes. I use an electric brush, an automated brush that has an attachment that attaches to it. That it kind of automatically will clean you. It's quite good. I like automated brushes. I like automated brushes because you get a lot of action per unit time. You certainly don't need to have an automated brush, but I think they're quite good. They come in a variety of sizes and different head shapes that can fit in different parts of your mouth. And so I think they're quite good. But the important thing is, no matter what you use, either regular brush or an automated brush, is to do it methodically and thoroughly, and you'll be in good shape. So thank you. I'm open for questions.
Well, thank you. My goodness, that was certainly very thorough and covered a lot of ground.
Yeah.
If you would stop sharing so we can see everybody, I have a couple of questions in the chat,
Okay.
and then we will open it for people to ask their own questions. The first question is I think it should be a pretty quick one for you to answer. The question is it universal if somebody wants to change dentists? And they don't necessarily want to tell their dentist till after they leave. Is it universal to have the x-rays sent before you meet with the new dentist?
Yes. I mean, you should have, when your initial visit with, now different dentists will set up their initial visits certain ways. Some dentists like to meet their patients at the same visit. Some dentists like to have an initial visit where they see the patient and briefly after the hygienist, and then get together for a more extensive consultation. But in any event, yes, your x-rays belong to you, and they should be transferred. Most x-rays these days are digital x-rays, so they could easily be transferred via email to the other dentists. And yes, that's the short answer.
Okay, thank you. And then I'm going to do one from the chat, and then we'll go to people on the screen, and then I'm going to go back to the chat. Okay, so the next one from the chat is, what is your opinion on water picks?
Water picks. Water picks are fine. They can be helpful, particularly if people have crown and bridge work where you want to kind of swish underneath them to help out. One thing you should know, though, is I kind of liken a water pick to, let's say you wanted to wash your windows, okay? So you can stand outside your house and take a hose and spray it against your window, and it's going to get some of the window dirt off. But you need some mechanical energy to actually wipe the window off. So a water pick is a fine adjunct to cleaning out particles and stuff like that. It is not, in my opinion, a substitute for flossing, because you do need some mechanical energy to actually move the plaque off your teeth. But it's fine. Yeah.
Got it. Does anybody want to ask a question? Linda.
Yes, I have three. One,
Okay.
I'll be
quick.
I'll be quick. I have a night guard, and I've been soaking it at night. It used to get really yucky looking, and I had trouble cleaning it. I've been soaking it at night in a combination of hydrogen peroxide and water. Is that okay?
Why are you doing it that way?
Because somebody told me that would help me, and it certainly makes it clean. So, but it was supposed to be much more water than the hydrogen peroxide.
Yeah. Yes, I would say that. Probably hydrogen peroxide would be fine. By the way, when you bring your night guard, do you bring your night guard in when you have your?
I took it, I asked my dentist about it once, and they didn't have any help for me to clean it. So I went to my friends.
Here's well, did they clean it for you?
The dentist, no.
Well, here's what should happen is that, every dental office has, as part of their cleaning of instruments, there's a kind of a pre-cleaning that's done where they put it in in a vibrating, kind of like we put jewelry in, and it's a bath that vibrates particles off things. So every dentist has in their office. So what we should do, and what you should ask your dentist to do, is you put your night guard in a plastic baggie, and there's a special cleaning solution, and you put it in there for, during your course of your cleaning. When it comes out, all the plaque and tar and stuff is off there. So you
This is
should.
at the visit itself you're talking about?
Yeah. Yeah. And then I don't think there's anything in, certainly if you're using a dilute solution, I don't think there's anything that would hurt it. And of course, rinse it off before you put it back in your mouth.
Yes. But
Okay.
but it does come out really clean. I mean, it solved my problem with yucky, whatever.
So,
Okay.
so it was better than just water, you were saying.
Yes, yes.
Okay.
Okay, my second question. I only have dry mouth at night. So I wake up in the night and I'll drink water. I don't notice it during the day. Is that something I should be worried about, or is it,
So you feel like you can swallow okay, and it's not
It's real dry, real dry. Like, yeah, I could swallow. I mean, it won't keep me.
Yeah. Well, you might be a mouth breather, at night. So you could be drying your mouth out that way. So, you could be having some problems breathing at night. That's something you might want to talk to one of your doctors about.
Mhm.
So that's probably the cause, if that's the only time you notice it.
Yeah, okay. Maybe I'll tape my mouth shut or something. I don't know. Never mind.
Good idea.
Okay, my third question has to do with fluoride. I haven't had any cavities for years and years and years and years. And my dentist used to want to charge me for a fluoride treatment, which I usually didn't take. But now he's got this thing, I don't have insurance. So he's got this thing where you pay $500 and you get several visits for that. And it includes the fluoride, at no additional cost. So I'm doing it now. But is it something that I need? I don't get cavities.
Okay. So the $500 is for what?
It's for several visits, cleaning and x-rays and stuff like that. I pay that for a year.
Oh, you mean it's like a pay up front kind of thing?
Yeah, it's like it's not insurance, but it's his way of helping patients that that don't have insurance
I
to.
see. So like a fixed fee for that kind of thing.
Yeah, and it
Yeah.
includes certain things and emergency visits, and it includes quite a bit. But
Yeah. Well, I guess my short answer is that, of course, I don't know your mouth, and I don't know, I haven't diagnosed you, so I can't talk to you specifically about that. Since it's incorporated into the fee, that's probably okay then. So I'd say, you can continue doing it, but you might want to ask, why are you doing the fluoride? Do I need the fluoride in particular?
yeah, I used to tell him no. I mean, when I was just paying separately, not to do it because I didn't think I needed it. But he seems to have that as a general.
Yeah. Ask
I
about
probably don't need it if I don't have cavities. Does that make
Well,
sense?
I don't want to diagnose you digitally here. But
Well, I'll continue to get it because it's now included, but I was
Okay.
just curious
Yeah.
as to.
But certainly if you get cavities, or if, let's say, he's noticing, it's a he, I guess.
Yes.
If he's noticing, maybe some of your fillings are getting older and he's worried about some of the margins opening up, and it might help to remineralize it. That's the reason, but certainly ask.
Right. But since it's included, it's not going to hurt anything, right?
Did he offer you undercoating?
I don't even know what
Really?
that is.
It's something car dealerships offer you.
Well, I was thinking, don't they do that for cars when you said it?
Right.
No, he hasn't offered me undercoating, but anyway.
That's
And then
good.
you get a 15% discount if you do this annual thing. You get a 15% discount on things that are over and above. Like if I need 3 visits to have clean, he's now telling me I need 3 visits a year because my plaque, I'm getting plaque faster.
Yeah,
But I don't know that I do. I'd rather just go with the 2, but that's a whole nother issue.
it's a matter of trust. My car's in a repair shop, and he just called me up and said it was going to cost me more because of something that happened. So, I mean, I don't know. I said, yes, do it. I trust this guy. I worked with him before. So sometimes you just have to, trust somebody to do something. But if you have I certainly asked why this had to be done. But, certainly if you have, you should always feel free to ask questions of your dentist. That's
And he's good. I mean, I like him. So, but it's just these little silly things.
Right.
But thank you for the hydrogen peroxide thing, because I didn't know if that was okay, because I just got that from a friend. But it works. It works really well.
Well, if it works, I guess don't knock it. I see we have a couple of more questions. So, Sarah, I see your hand, and Tony, did you?
Tony, Sal, I have a new dentist, and he gave me a mouth guard for the first time in my life. And then he just said, bring it in, and then they deal with it. And while I'm there, and he just said, just wash it with soap and water.
Yeah.
Rinse it out and put it back in the little, in the box, let it air out. And I've noticed, frankly, that because I do the same thing as Linda does, but when I wear the mouth guard, I don't snore in my mouth, and my mouth is closed, and I sleep better. So it stopped all that.
With the night guard.
Yeah.
Yeah, of course, there are a bunch of reasons to have a night guard. Sometimes it's done because you're having jaw joint problems.
Sometimes I'm grinding my teeth.
Yeah, you could be grinding your teeth instead of.
Yes, I am, yeah.
I've had a night guard since I was in my 20s, because I was grinding my teeth. So at least they're still there now. I haven't
Right.
down. So it's worked well.
See, you have teeth. That's good.
Yes, I have teeth.
Anyway.
Yes, person with their hand up.
Yeah, this is Risha. You said that implants need some special cleaning, and I'm in the process of getting one. So what's your recommendation?
Well, depending upon where it is, talk to your dentist, but you might need one of those little brushes, because many times when you have an implant, with teeth, when one tooth is next to the other, your gums kind of go up into a pyramid between the teeth. So many times when you have implant, it's hard to maintain that. You get kind of a flat aspect to the gums in between your teeth. So in that cases, a little brush could be quite helpful there. So
Thanks.
basically, yeah, you need to have something that will touch the entire tooth surface, and sometimes just flossing is inadequate.
Okay, I'll ask him about that. Thank you very much.
Okay.
Thank you. Okay, Susan, I see your hand up electronically. Don't forget to unmute. There you go.
I just had a quick question. Years ago, in the beginning of the AIDS epidemic and pandemic, in like the 1980s, I started to get a little anxious at first about going to the dentist. I thought, oh, I want to be careful about, disease transmission and stuff. So I'll make the first appointment of the day, and then I'll like just have ease of mind about that. And then when COVID started, I thought, because everyone was worried a few months, some of the places closed down, that, you could get COVID from everybody's aerial transmissions of stuff. And so it's like, okay, well, I guess the first appointment of the day, like that'll make me less worried. Is there any concern now about, is it just kind of standard that most dental offices are super careful, and that you shouldn't be worried about, like, say, any bloodborne thing getting to you? I don't know about aerial, like with COVID, but I was just kind of curious if you think that's been, if I should worry about that anymore, or no, because like everyone's so careful and they clean their instruments and stuff. I was just kind of curious.
Yeah, there's something called the Bloodborne Pathogen Act, and there are standard procedures. They're pretty complex. When you leave a room, there's a whole set of procedures that are done for that room, including wiping the surfaces, using barriers whenever possible. Of course, the instruments are sterilized, and that type of thing. That being said, you use your eyes, and when you go into a dental office, if it looks like it's well kept, and stuff like that, but there are pretty strict standards for how instruments and the materials that are being used on you should be used. So in terms of being in the office in the beginning of the day or the end of the day, I don't think it probably makes much of a difference, but your dentist might be more awake in the beginning of the day, so that might make
Always a good thing to have a dentist who's awake.
Right.
Okay. There was a question in the chat. It was kind of a unique phenomenon, and the question is, that the questioner asked said that she understands what you've been teaching about how poor cleaning can result in decay, but there was a phenomenon where she had a zero decay, but a fracture in a tooth that reached only below the gum line, yet resulted in significant jawbone infection. And there's a question, how is that possible? If there was no decay,
Yeah.
but suddenly there was a jawbone infection.
Yeah. Well, she's talking about a fracture in the tooth that caused that.
No, in the bone, in the jaw bone, which was found later on an X-ray after everything was done, the root canal was done and everything, and everybody said, "Oh, look how your jawbone cleared up." Who knew there was an infection all the way down there to begin with? And it's not from a bisphosphonate. It has to do with this fracture. I don't see how a fracture could have infected the bone.
Okay.
Does that
but-
make any sense?
Well, I just want to get the
If it
circumstance.
if it doesn't, that's good to hear that it doesn't.
Well, I just want to get, so you had a root canal and then you had a fracture? Is that what happened?
There was a fracture, and then I was sent for the root canal, and that cleaned everything, even though there was nothing in there. And then there was an X-ray at a follow-up with the endodontist with an X-ray, and he said, "Oh, how lovely. Look, there's no more infection in your bone." And he showed me the bone.
Yeah.
Then I went for a cleaning, and the other guy, he did a whole panoramic, the regular dentist, and he said, "Oh, look, it's all gone." And I think it's gone because I had such a good endodontist. He cleaned
Yeah.
everything, but there was never any decay. It was just a fracture, and it never made any sense to me.
Yeah.
How could it have gone all the way to my bone?
Okay. Well, what can happen is you have, of course, I don't know the exact circumstances, but I suspect what happened is you had a fracture in the tooth. And when the fracture in the tooth allowed bacteria to get inside your tooth, and that infected the nerve of the tooth. Now, if you remember that picture of the tooth I showed you at the end of the tooth, that's where the nerve and the blood vessel enters into and forms the pulp of the tooth. Well, what happens if the nerve gets infected, the bacteria have really only one place to go. So the fracture caused an ingress of bacteria, and now the bacteria killed your nerve, caused it, and then it shoots out the end of the root, and the bacteria and the inflammation causes your bone, the osteoclast of your bone, to, even though you don't
Okay,
have
so the root was infected. I mean, the
root was
nerve.
infected, right? And
The
then
nerve got infected by bacteria.
yeah, which is a bad, and then you lose bone. But then once the nerve is taken out and a good root canal is done,
Really good.
then what happens is that your body's homeostatic mechanisms take place, and it heals itself. It's like a wound in your finger. Cut your finger, it'll turn into a new finger, at least a new skin.
But if you have a toothache and you don't get an appointment for 3 months, and then it winds up being, then you have to have a root and nearly lose the tooth, and then they got to save the tooth and the whole thing like that, because is that possible that in only 3 months you could lose the tooth, and this whole thing, it was crazy. Oh,
Sounds
because
like you've had quite the
I couldn't
experience
get an
there.
appointment for 3 months with a toothache, a very bad toothache.
It sounds epic.
It's really bad. It's really
Another
bad.
So luckily, this was not one of your patients.
I hope it helps other people to hear some of it. What did you say, Lynn?
I said, luckily you were not his patient.
Yeah, I wish I had Dr. Sal. I wish I did.
I'm glad this worked out for you.
Yeah, thank God. The endodontist saved the tooth. Thank you.
We're not all bad guys.
And thank you, Sal. This was really so informative. Really, we are very fortunate. Thank you to our healthcare committee. Thank you to Sarah, who actually helped find you and bring you into us, and we really appreciate it. And as I mentioned, this is the first of the partnerships with our healthcare committee and our program committee. So keep your eyes peeled for more fabulous programs. Thank you to everyone concerned. Fred, Sal, really appreciate it. And thank you for your time.
Nice seeing you. It's my
Yes,
pleasure.
thank you
Have-
so much.
Everybody have a good
Thank you
Thanksgiving.
both.
Thank you, Sal, very
And
much.
thank you
Thank you.
to
My
the
pleasure.
village and to both of you.
Our pleasure. Have a nice
Great.
weekend and a great Thanksgiving, everyone.
Wonderful talk. Thank you. Thank you so much.
Bye-bye.
Wonderful
Bye.
and